Hi everybody, today is week 9 of my snap-iversary of my Achilles tendon rupture. My Achilles tendon rupture occurred on December 10th, playing soccer, full complete rupture, 2 centimeter gap confirmed by clinical exam and an MRI. And I'm just doing another update to see, to show everybody how my progress is going and what the new things I'm doing to keep on healing. So first is I've been out of the boot for about 2 weeks, a little over 2 weeks, 2 weeks and a day or two, and my walk's gotten a little bit better. I just by chance have tried some different shoes. I bought some different shoes, and I have a pair of boots that I bought for the purpose of riding my motorcycle. They have a nice heel and some good ankle support, and just decided to try those on because of those things, and I really like them. So I've been wearing them every day to work and everywhere I go. The support and the little heel lift with the gel pad in there has worked really well for me. My walk is very, very solid. Not healthy or anything yet, but really pretty good with these shoes on. So I just want to show you how I walk with those shoes versus how I walk barefoot. So here's a little glimpse of that. Oops, sorry. So that's my slow walk. Here's how I walk fast. And as you can see, the slower is much smoother than the fast walk. Once I start going a little faster, it becomes a lot more stiff and robotic. But overall, pretty smooth for being 9 weeks from the complete rupture. These boots make a big difference. I'll show you my barefoot walk, which isn't as good, but again is improving compared to 2 weeks ago, even a week ago. So here's that walk. So a lot more stiff, and that was my slow walk. I'm not even going to show you my fast walk barefoot because it's just more stiff and more robotic. I don't even try to walk fast barefoot. I've also been doing my heel lifts, so I'll show you a couple of those and what I'm doing to kind of track my progress. See, there's a scale there. So, kind of warm up, a little warm up going here. Just make sure everything is loose and firing. And I've got my scale up. And so I put my hands on the counter here, and then I lift up and I see how much weight I'm putting down in a heel raise, and I hold it as long as I can. Okay, now I don't do many sets of those because I'm pushing it to a pretty high degree where my calf gets pretty sore right away. And I'm also doing the same thing from the bottom up, which I don't do as much weight. And I push up. Oh, clumsy me, I turned it off. That's good, it gives me a second to break anyways, because that was hard. So I go here, and I push up, and I see what weight I'm pushing on. Okay? So that is one way I'm tracking my progression of what load I'm putting on the Achilles and the calf raise. And my highest number I've gotten recently, sorry, get this light out here, is for the one where I start at the top and just hold it, I put about 100, 105 pounds on. And the one where I start at the bottom and do a heel lift, I've gotten like maybe 80 pounds. So my body weight currently is about 180, 182 pounds. So for the heel lift, I'm close to 50% body weight, which, you know, my 9-week mark, I'm pretty happy with that. So, and then the fact that I can do over 100 pounds, 105 pounds, holding at the top of a calf raise, you know, I'm pretty happy with that too. And what's important to know is I go until I feel strain in the calf muscle. I do feel a little bit of strain on the heel bone where the tendon connects. So to me, that's good because it means the tendon is connected to the heel, it's connected to the calf, and it's actually tugging on the heel, so it's good to feel a little bit of pain there. I don't want to do too much and cause a tendonitis issue or cause any inflammation there, but I feel it a little bit, okay? And if I do feel any strain in the Achilles itself, especially the injury site, I pull back right away. So that's one of the main things I've been doing, just kind of using this scale, which I've been quite a big fan of, every couple days just to see if I'm progressing and doing well. Now, it's not like I have to add weight to it every time. Don't look at it like that, just whatever feels comfortable. And, you know, success, of course, doesn't go like this, feels like this, you know, but overall from here, going this way, keep on doing that. Another one of the ones I use for the heel lift, I'll show you here. Is I use both hands, I hold the wall, which you can't see, just one hand on the wall here, and I lift, and then this is my injured leg. I lift, and then I kind of put my one foot out further, not too far, this is about where I can do now. I keep the body weight over this leg, and I lift, and then I come down. So just staggering the foot over to the side and keeping the weight over the injured leg. This right healthy leg just becomes a good healthy support, but the left leg is doing the bulk of the work. So again, I lift, and I come down. And I'm not sure how well you can see it from that video, but my calf muscle is firing a lot, which is awesome. I'm super excited about that. The big bulgy calf muscle, the gastrocnemius on the top, is really starting to pop back out again, which, you know, after 2 months of being essentially an empty balloon, it's nice to see that thing working again. So I'm excited to keep it growing and keep doing the rehab. The soleus underneath is doing the majority of the lifting, but seeing the gastroc become engaged again has been a sight for sore eyes. So really excited to keep that progression going. I do monitor, put this down again, the dent where the injury is. And again, it's not the easiest to see, but it's right here. You can kind of see a little shadow of it right there. When I do my raises, see a little bit of a shadow where the injury was. It's really thick everywhere else. That little dent is still there. It's hard and it's connected, but still goes in compared to up above and below. And when I do feel any tension of the Achilles, if I notice it in that dent area or even close to it, I pull back so fast and take the load off completely. and then just do it again with another lower load. So I'm doing that kind of exercise, not very many reps, because those are heavy reps for what my body's able to do right now. So I do a couple of those a day, maybe less than 20 total probably, and I don't even do them every day because I want to give it a chance to recover. But it's been working pretty well for me. 50% body weight heel raise without any strain. It's pretty good. I'm pretty happy with that. My walk's coming along pretty good. The one thing about my walk is, and it's a big limiting factor, is a lot of the walk, when you walk, you step, you dorsiflex, and then you push. So this position, this is my healthy leg, you're stretching the Achilles, loading it, and then pushing, which is one of the most difficult parts. I'm vulnerable there still. So my injured leg, this is it. This is as far as I can push my knee. So that's my knee. Here's my foot, putting it to a wall. That's all I can do before it feels like it's really, really tense. My other foot, I can do about, I did a measurement once. It was about 6 inches to the wall for my foot, and this, I'm like a -4 inch. So that's a limiting factor. I can't roll and get into the right position to push off. And then the push off obviously isn't as strong either. So when I'm walking, it's nice and slow. I kind of wait till I have my other foot and I'm guiding it at a very comfortable level, not really putting much stretch on the Achilles. I'm not doing any stretching thus far besides just my normal walking gait. And I'm pretty happy. I don't really plan on stretching with any intent until I can do some solid heel lifts, and then I'll start worrying about getting the mobility back in the Achilles. I just really want to worry about the strength, making sure I can press through, use the Achilles like it's supposed to be used, and then I'll worry about getting the dorsiflexion back. So no rush on the stretching. Happy where I'm at so far with it. Excuse me, steal my notes here for a second. Another thing I've been doing is 1 foot balancing. That's the same as last week, but now I'm trying to do it with my eyes closed. That's a game changer. That is a game changer. Doing it with your eyes closed is so hard. So here's 1 foot, easy peasy. Then I'm gonna close my eyes now, and it gets so much more difficult. One more time. Eyes are closed. I have a tendency to fall towards my good foot. I don't know if it's a protective mechanism, and I'll be honest, I'm still working on those. Majority of them, I can do it for about 7-8 seconds. I've got a couple good ones where I got the right arm counterbalance and I made it like 30-35 seconds, but that's few and far between. It's usually 10 seconds or less, but I feel like a good tension, a good tug of, just balancing, putting the right amount of tension on the Achilles, doing those. So I'm continuing to do those. On my good foot, I can do them pretty well, so I know it's gonna come back, just more reps, more repetitions. So I've been doing those throughout the day too, trying to develop that balance again with the Achilles. Another thing I wanted to talk about before I go here is the heel pad. So I have noticed on my heel pad, you've got these big kind of cushions under your heels right here. And my injured one, it's much better than it was 2 weeks ago, but it still gets a little sore because it was underused for 2 months. So right here, I push in, and again, like the calf, it feels a little empty. It pits a little bit. So that's developing and coming back slowly, but it almost feels like a blister where you have loose skin around the heel, whereas this one's nice and full. So definitely in that fat pad coming back. It is better already in 2 weeks than it was, but definitely noticeable. So I wanted to talk about that as well. And I've read a bunch of that, heard other stories about that, so to be expected. One of the other things is I stand on my feet all day for work. I've been back to work since day 10 of my injury. I do stand all day for my job as a pharmacist. So I do notice my feet. Let me switch here. Are different colors. If you notice here, it's actually not that bad right now. It's a lot more noticeable sometimes, but the injured one stays significant color of red or purple versus the other healthy one. And I think it's just part of the inflammation response, the healing that's going on in the Achilles kind of floods down to your feet with gravity. So a nice red purple color is pretty much always there, except for when I first wake up in the morning after sleeping, because you're not, gravity's not involved. So that's where I'm at right now, week 9. The heel lift's coming along, the walk's coming along, feeling really solid with everything. Wanted to share that with you. I do have a doctor's appointment coming up with my surgeon, who's gonna go over some things with me. And one of the things I'm really interested to learn about and talk with him, and I've done a good amount of reading on it, I still haven't quite nailed down what it means, is my MRI indicated I had severe tendinosis. So not to be confused with tendinitis, tendinosis, which is essentially a chronic overuse collagen breakdown of the tendon, which means that the tendon's elasticity and tensile strength was bad. It wasn't what it was supposed to be. So I'm kind of interested if that's a typical MRI finding. Was it the cause of the injury? Does it mean my other Achilles has that same problem? Is it something that if they scanned for athletes, would they find it normally in healthy people? Or if they scanned for it and found it, does it lead to increased chance of rupturing? A lot of questions about the severe tendinosis that the MRI had for me. So I hope to get some insight on that in my next appointment and bring that to you guys here on YouTube and in the Facebook group. I've had a couple people reach out to me about my progress and what I'm doing. So I wish you guys the best of luck. Keep doing what you're doing. My advice is stay active, do what you can, progress, keep progressing, stay with the exercise, keep moving. The calf will come back and everything will get healthy, but be smart. Don't do dumb decisions. Don't try to do things your body's not ready to do. So for me, I'm loading it in a very, very safe, cautious manner, not stretching it, not doing the dorsiflexion yet, and just, working from there. So maybe another video in another week or two. Hopefully the calf's even bigger by then. Hopefully I'm closer to 75% body weight on the heel raise. And I'll talk to you guys then. Be well.